As opioid abuse continues unabated, some communities are focusing on keeping the drug users alive. And one approach gaining traction around Massachusetts is called post-overdose outreach. New England Public Radio's Karen Brown has a 4-part series that explores this approach, as well as the reaction to its use by law enforcement and some members of the legal system. She sat down with me in the studio to share what she discovered in her report.
Well, I actually had been doing a lot of stories about opioid addiction and addiction in general, and I just kept hearing about this new outreach program called the DART program, Drug Addiction Recovery Team, where it just sounded like a great opportunity for a radio story, frankly, to go out with police officers as they're trying to follow up with people who are using drugs. And I just thought that was a new and interesting method of helping drug users, and also a new role for the police. And I actually, for this series, don't actually go out with police on their visits, but I, find out how the program works.
And you check in with people who are actively involved in the program, and you hear about some of the pros and cons and some of the trouble behind it. But just let's back up a second and talk about what post-overdose outreach really is and what it entails.
Right. So the idea is people who have an overdose are extremely likely, and survive it, are extremely likely to have another overdose and possibly not survive. So the people that developed this kind of model, which is not just happening here in Hampshire County, but in many other places, thought, how can we find these people who have overdosed and get them help before they overdose again? So that's essentially what it means, post-overdose outreach. And the police department seemed like the most natural place to start, because they're the ones that answer the 911 calls, which is where you hopefully call after an overdose. So that's how these different different teams sort of got involved in reaching out to people post-overdose.
Yeah, but isn't that also a bit tricky, because as I think one woman who you interviewed speaks to the fact that, okay, she's using an illegal substance that she knows she shouldn't be using. The last people that she wants to hang out with are the police.
Right.
So how are people confronting that challenge?
Well, the police are finding that, this is not the kind of program where everybody's like, oh, great, thanks for helping me out. For one, because, as one of the people I interviewed said, every time they've been on drugs, they've been running from the police or trying to hide the drugs, or, that's not the first person they want to see. So this is part of the learning curve I'm hearing from police officers, where they go out and they wait a certain amount of time after the emergency is over. They introduce themselves. They are generally in their uniforms, but they try and explain, we're here to help, we're not here to arrest you, you're not in trouble. But they are finding that not everybody is really eager to see them. So in many cases, they go back again. Maybe they say, okay, you're not ready for me now. Can I come see you later? Maybe it takes a few months. And it's not just the police. They also say, well, if you don't want to talk to me, maybe you want to talk to a recovery coach. And that's also part of the program. Or maybe you don't want to talk to me at all. Maybe you just want to find out where to get clean needles. Or maybe I can just help you find a hot meal. So there's a kind of a range of options that they offer depending on how receptive the person is, after going through an overdose. And also I should add that it's not only people who have been through overdoses. That's often how the 911 call sort of brings them to the program, but sometimes it's just people who have been involved with other kinds of crime, maybe related to drug use, like shoplifting, or they find out through some other means.
So if a police officer is encountering this person who they might typically charge with a drug offense, how are they choosing to say, okay, well, I'm not going to use the full hand of the law in your particular case? How is that fair? How is that even legal? Did they talk about that at all?
You mean to not do the arrest?
Right, to not do the arrest.
I think it's tricky. I mean, I didn't actually probe into the legal issues, although that would be a good follow-up story. But they basically say, this is not why I'm here. And they're trying to, this is part of a broader change in how law enforcement is dealing with drug use in general, trying to move away from arresting for low-level offenses like possession or like shoplifting.
Right, because we're not talking about the drug kingpins here that are being offered this type of assistance.
Right, and in fact, I interviewed the district attorney of Hampton County yesterday, who was saying, he still feels like it's important to get at the dealers and, people who are selling and people who are pushing drugs, but this is for folks that are more victims of the whole epidemic.
Right, because that's also a big change that we've seen with not only the opioid epidemic, but with marijuana being legalized, just people coming out and saying, look, maybe this is a racial justice issue because Black and brown people were disproportionately impacted by marijuana arrests or related to crack, and is it fair to treat people in this way? So interesting to hear the district attorney saying, no, we are still going to pursue legal, or the illegality of this issue.
Yeah, and that's actually interesting. I have heard comments from listeners to some of a previous story I did on the same program, in which they express sort of the frustration that why is there all this empathy now with people when it seems like there's more middle class, more white users of opioids.
State statistics point to the fact that typically it's 50 plus, I believe, white men who typically use opioids or abuse.
Right. So there is a question, should they have been doing this during the crack epidemic when there were more people of color who were affected? I think that's a fair question to bring up. I don't really get into that in this series.
You also talked about recovery coaches. Talk about their role in this and how they work with these people who are struggling with drug use.
Right, so a recovery coach is not a clinician. It's somebody who has an addiction history of their own, and they've been trained to help people through their own recovery, or maybe to get into recovery, or to just be a source of support. And the DART program has police working with coaches. So as you pointed out, maybe the police are the first contact, but maybe somebody who's using drugs doesn't want to continue a relationship with a police officer, but they might with someone who is more of a friendly presence, someone who has a history of addiction and understands it. And so they often push off the program to the recovery coaches, or the handoff, more to the point. And then they develop a relationship that way, and then that tends to be where the long-term relationship ends up.
And it's not always a happy ending, as you report, right? Sometimes these people just stop using the program or stop being interested. So how do the coaches sort of navigate the difficult nature of what they're dealing with?
Well, I think they find it very sad, like any human would. I think what they tell me is the examples of success are what they get through, and there's enough people that are very grateful and that really go through the program and get help and do better. There are many cases where that does not happen, and I think you learn the realities of addiction and the reality of relapse, and they just cope with it.
Right now, there might not be enough evidence because this is such a relatively new program, but we know that opioid overdoses, while deaths have gone down, the overdoses themselves haven't necessarily gone down. Did the recovery coaches or the police officers talk about if they feel like this program might help to sort of even out that statistic where people are actually getting better more often?
Well, that's certainly the hope. That is a challenge of this program, is finding out what causes what. And this is something I talk about in one of the stories, is the challenge of measuring what the outcome of this kind of outreach is. Because overdoses are going up because of the problem, that doesn't mean they may be going up slower in places where they have this kind of outreach. So there's a lot of confounding factors, and some of the officers were saying, everyone wants proof and they want numbers, and it's just very hard to actually prove that this is helping. I don't think anyone's suggesting that it's hurting, so there's that piece. There is a limited amount of research so far because this is a relatively new approach. So there are addiction researchers who are specifically trying to see not just does post-overdose outreach work to reduce fatal overdoses, but how does it work best? What are some ways a program can do a better job than others? When do you push, for instance, hard for someone to go into recovery, and when do you step back and say, okay, I'm here when you need me? Those are the kinds of nuances that they're still learning how to put into place.
One last question. What do we know about the rates that police departments are actually using this or interested in using the program?
Well, there's 150 communities across Massachusetts that use some model like this. The program that I looked at that specifically started in Hampshire County, called the DART program, is now in about 13 places in Hampshire County. It's just now expanding into about 10 places in Hampden County, with the exception of Springfield, which is, of course, the largest city in Hampden County. I've been trying to figure out, why they're not interested in taking part, what they're doing instead. That's been challenging for me to figure those answers out.